We have an hour and quite a bit of information to cover, and I know many questions, some that have been submitted in advance, and I know others that can be submitted. So I'm going to introduce myself. Good morning, good evening. Welcome again to our COVID webinar. It's an opportunity for us to give you an update. We're looking forward to hearing your questions. My name is Julie Kornfeld. I'm the Vice Provost for Academic Programs here at Columbia. Have a wonderful and distinguished panel joining me this morning, and I'll do a quick round of introductions. We're excited to welcome you this morning, and even more excited to welcome you back to campus. Many of you may have joined us in previous sessions, so this will be very similar to others. If this is your first time, we're going to provide you with an update as to what is happening with the COVID-19 pandemic globally, and more importantly here in New York and on campus. And we want to also share with you the very detailed public health plans that have been put in place to ensure a healthy and safe return to the campus. We're ready for an in-person return to campus activities, and importantly to our classrooms. So excited to join you today and to see you on campus very soon. Please use the Q&A box throughout the session. We'll be answering questions in real time, and also we'll have we'll set aside a few minutes at the end to try and answer questions live. Many of you submitted some of those questions in advance. Let me quickly do a quick round of introductions. We have Dr. El-Sadr, the University Professor of Epidemiology and Medicine and Director of ICAP at Columbia University. She will give our first presentation. Donna Lin, our Senior Vice President and Chief Operating Officer of Columbia University Irving Medical Center and our University COVID Director. Donna is going to play a role behind the scenes in the interest of time today and answer a lot of our questions as they're coming in. Melanie Burnitz, Associate Vice President and Medical Director for Columbia Health. Joseph Greenwell, Vice President for Student Affairs and Office of University Life. And we're also joined by Maria Reynosa, who's our Senior Associate Director at our International Student and Scholars Office. And she will be available to answer questions if you have immigration-related questions or visa-related questions. So I'm going to turn things over to Dr. El-Sadr so we can get going.
Okay, thank you very much, Julie, and thank you for the opportunity. And I will share screen quickly. Looks okay, Julie? Okay, great. So let's get started. So I'm going to give a very a brief presentation this morning. Here's an outline of what I will focus on. First, the pandemic status and vaccine coverage. I'll touch on virus variants and vaccine effectiveness against these variants. Then I'll talk a bit about the post-vaccination, what people have called breakthrough infections, and define that for you. And then we'll touch on the Columbia University monitoring plan that we have put in place and end with a few conclusions. So let's get started with the status of the pandemic. So as you are aware, we continue to see an increase in numbers of cases here, more than 207 million confirmed cases of COVID, and more than 4.3 million deaths have been reported thus far. Interestingly, you'll notice now that there's a different order in terms of the top 5 countries in terms of the cumulative numbers of cases reported. The US has been leading since the beginning of the pandemic, followed by India, Brazil, and now we have Indonesia and Iran following Brazil in terms of largest numbers of cases reported thus far. Now, in terms of the recent hotspots, and here you'll see in this map, the darkest red or maroon color are parts of the world where we have the largest or the highest average daily numbers of cases per 100,000 populations in the past week. And you'll see the hotspots around the world, which include Botswana in Southern Africa, several countries in Asia, several countries in Western Europe, and the United States. It's interesting that this changes week to week, and you will recall in prior webinars, at some point we had India was very much a hotspot around the world. So you can see the dynamic nature of this pandemic as it changes and moves from one country to the other. Of course, we know that vaccination is the foundation of prevention of transmission of this virus. You can see here in this map vaccination, and this is per 100 persons in countries around the world. Darkest green means the highest rates of vaccination. And you'll see several countries around the world that have higher rates of vaccination, including North America, parts of South America, as well as China and several other countries in Europe and the Middle East as well. You will note that, unfortunately, the African continent stands out as the one continent where there's been the least access to vaccination thus far. Now, what's happening in the epidemic in the United States and New York City? You can see here on the left, this is the surges that we've experienced in the United States in terms of numbers of cases over the past year and a half. And in the US now, we're experiencing this increase in numbers of cases over the past several weeks. Interestingly, with this increase in numbers of cases, we haven't experienced a concomitant increase in hospitalizations and death. And this is attributed to the largely higher vaccination rates now in the country versus during the earlier surges in our country. When we look at New York City, now we've reached more than 1 million cases. Actually, we reached that over the weekend, reported cases in New York City, and more than 33,500 deaths have been reported. And similarly, also in New York City, we're experiencing the surge in the numbers of cases of COVID-19, but also similarly, not with a concomitant rise in hospitalizations and death. And it is thought again that this is because of higher vaccination coverage in New York City and in the US overall, although there are enormous variability in terms of vaccination coverage within the United States and even within New York City itself. So let me switch now to touch on viral variants and vaccine effectiveness in that context. So as of course, the issue of the hour is the Delta variant. And you can see here, this is in the darkest blue, are areas of the world, countries of the world, where the Delta variant is the highest percentage of all of the sequenced viruses in that country. And you will see that over the past several weeks, if not a couple of months, that the Delta variant has really become the dominant variant globally. But there is variation, obviously, as you can see here, with some parts of the world like the US and Russia and Australia and Southern Africa, where the Delta variant is about 80%, if not more than 80% of all viral strains that have been sequenced. And this is the same here. You can see in New York City, about 83% of isolates in the United States that have been sequenced have been Delta variant. And similarly, also, you can see as well the predominance of more than 95%, the predominance of viral variants in New York City have been sequenced, have been Delta variant. What we know about this, without a doubt about this variant, is that it is more highly transmissible, meaning it is easier, it's more contagious. So we have this number that we always use, which is a number of people that one sick person would infect on average, and it's called the R0. And you can see here for different, the original strain, Wuhan strain of SARS-CoV-2, it had an R0 of 3, meaning a person who is sick with COVID-19 would transmit to an average of 3 people. And you can, in contrast that with the Delta variant, where the average is transmission to 7 individuals. But you can see also how this contrasts with other infectious diseases that are more highly transmissible, as noted by their very high R0. So that's what we know about the Delta variant. We are not 100% sure if it's associated with people getting sicker as of yet, but there's a lot of research ongoing to determine that. Now, what about vaccine effectiveness against the Delta variant? There's studies that are now arising, and this is one of them looking at Pfizer, BioNTech, and the AstraZeneca vaccines. And what you can see here is that when you look after 2 doses, and this slide is important to remind you that it's absolutely vital if a vaccine is to be given in 2 doses to get the 2 doses. You can see the difference in protection here, the vaccine effectiveness on this axis here, the higher the better. And you can see that after there's a big increase after 2 doses versus 1 dose, so that's good to remember. And then contrast the Alpha variant versus the Delta variant in purple, and you can see that with this vaccine, with the Pfizer, BioNTech, and the AstraZeneca, that they appeal to retain effectiveness against these these variants. And you can see again here, summarizing that's about 88% effectiveness with Pfizer BioNTech vaccine, about 67% protection from the AstraZeneca vaccine. Now, this is about the Johnson & Johnson vaccine and its effectiveness against different variants. This is a very large study conducted in South Africa, where the Delta variant was also predominating. You can see here that with this, with the J&J vaccine, they had 67 protection against the beta dominant. This is a variant that circulated in South Africa, Southern Africa, and then 71 protection against hospitalization with the Delta variant. So this is also reassuring news. We don't have as much data on some of the other vaccines, including Sinovac, Sinopharm, and we're hoping that more data will be accumulating in terms of and other vaccines and so on against to them to tell us their effectiveness against the Delta variant overall. Now, what about post-vaccination breakthrough infections? And these are defined as infections, COVID-19 infections that occur 14 or more days after vaccination. So I want to show you here, these are real world studies now. And these real world studies have looked at the Alpha versus the Delta. The Alpha variant is the one that was first reported in the United Kingdom versus the Delta variant in red. And you can see here that with the exception of data from Israel, we have data from England, Scotland, from Canada, and from Qatar that show that the Pfizer and the Moderna vaccines appear to be quite effective in terms of protection against, particularly against severe illness, hospitalizations in particular. In the experience from Israel, it looks like the vaccine, this is the Pfizer BioNTech vaccine, was protective against the severe COVID-19, but appeared to have diminished protection against infection and symptomatic illness. So there's a lot of different experiences from different countries, and you have to be cautious in interpreting these data because obviously the population that received these vaccines and in whom this was assessed varies substantially from country to country, and the timing of when people receive the vaccine also varies from country to country. And this is a recent study, just preprint, not peer-reviewed yet, from the Mayo Clinic system in Minnesota, and it shows the same thing as I mentioned before, more protection, as you can notice here, by Pfizer and Moderna vaccine against severe disease, meaning against hospitalizations. This is with the Delta variant. So what we know is that these post-vaccination breakthrough infections, that despite high vaccine efficacy, these vaccines work, vaccine breakthrough infections are expected. And we've known that from day one, because obviously no vaccine is 100% protective. And we know that these vaccines were largely developed to prevent severe hospitalization, severe illness, symptomatic disease. And some of these breakthrough infections will be caused by variants, even if the vaccine has similar effectiveness against the variants. And most of the infections that have occurred, breakthrough infections that have occurred, have been amongst older recipients of vaccines, as well as immunocompromised individuals. And very important to keep this last statement in mind, that with increased vaccination coverage in a community or a country, a high proportion of these breakthrough infections will occur amongst vaccinated individuals. So as you increase vaccine coverage, a larger percent of your breakthroughs will occur amongst vaccinated people. That's just the nature of the math, and keep that in mind. So in the United States, though, when we look at breakthrough infections in the US amongst different states in the US, you can see that thus far is that the majority of these breakthrough overall cases have occurred here in the orange amongst individuals who are not fully vaccinated, and a small proportion has occurred among those who are fully vaccinated. And these are data from Singapore that show, probably here, look at the bottom here, that again, amongst people who are fully vaccinated, most of the cases have been asymptomatic or mild symptoms in green, and then you go down to the completely unvaccinated group, and you can see more have occurred, more of the cases occurred requiring oxygen supplementation or requiring intensive care or leading to deaths. What we also know with vaccinated individuals is the good news that even if somebody gets infected on the day of when they're diagnosed, and this is the day of illness here, And this is the amount, this is a surrogate measure of the amount of virus in the nasal secretions. You can see they're about the same amongst vaccinated and unvaccinated individuals. But then what you see in the green dots here is that soon after diagnosis, among those who are vaccinated, the amount of virus in their nasal samples decreases substantially when compared to the unvaccinated group. So this is good news, telling us that it's likely, hopefully, that vaccinated individuals will be able to clear the virus more rapidly, and hopefully that this means that they're less transmissible to other individuals. I want to end with the slide and just, or almost end with the slide. And this also to remind you that there are multiple layers needed for protection against any kind of respiratory infection, or in this context, the pandemic, the COVID-19 pandemic, and that vaccines are one of these slices of the Swiss cheese here that protect an individual on this end from the virus. So the vaccines are very important, but nonetheless, there are lots of other measures. And I think you'll hear from Melanie about all the other measures that Colombia has in place to prevent transmission, including, again, the masking and the testing and the testing, the masking, as well as enhanced ventilation, and also quarantine and isolation of cases and contacts. And then, of course, we, as I mentioned at the beginning, to remind you that Columbia University has developed a framework for monitoring what's happening with the COVID-19 pandemic, and we keep an eye on this on a daily basis. And there are priority metrics we've identified for New York City in the order of priority: the vaccination coverage in the city, the hospitalizations, the deaths, and lastly, the cases in New York City. Then we also monitor at Columbia certain metrics as well, including our vaccination coverage, the PCR test positivity in random sample of individuals who are selected once a week to get tested. And again, the numbers of people who are positive from non-random sample, and also who get tested elsewhere. And we have different risk levels here that are color-coded. And this framework is posted on the COVID-19 Columbia website. So in conclusions, I think vaccination is a critical tool for prevention of SARS-CoV-2 transmission and control of the epidemic, and encouraging data about the effectiveness of vaccines against Delta variant, which is a dominant variant in the US now. I wanted to touch on booster doses, but I think actually just recently on Friday, there was a recommendation to provide a third dose to immunocompromised individuals who had received previously the Pfizer or Moderna vaccine, so only amongst immunocompromised individuals. And then I think it's important to know that as this evolves, the pandemic, there are distinct features in vaccinated versus unvaccinated individuals, and in highly vaccinated communities versus communities with less vaccination coverage. And then to remind you again is that our CU COVID comprehensive plan includes several components, each providing additional level of protection beyond the protection by vaccines. And lastly, take a look at our monitoring plan, which is again posted on our website. And thank you very much. And I hand it over to Melanie.
Thank you, Wafa. Good morning, good afternoon, good evening, everyone. Hopefully I can share my screen here. Okay, I'm good. Great. All right. So I just want to start by reminding you that the website that's dedicated to everything COVID is covid19.columbia.edu. If you haven't bookmarked it yet, you should. Everything we're saying and more is on that website. There are so many FAQs, there's a chat bot, there's real-time data updates. So really that is a great source for information. And most of the questions that we're seeing are actually on the website there. So if you have unanswered questions, do check that out. You've seen a lot about the global and the local picture. On the website, we always post our Columbia campus data. Throughout the pandemic, our situation has actually been better than even the surrounding New York City situation. We've done close to 300,000 tests on our campus. Our positivity rate has been consistently well under 1%. We also, as Wafa mentioned, do our random sample surveillance testing, which really shows us truly the prevalence on campus, and this has also been very low. And we'll continue to track that and use these indicators to show the safety of our campuses, and that helps us move through the monitoring, the color-coded monitoring plan that Wafa described to you as well. So I'm going to share a little bit about all the different things that you're going to need to do as you arrive on campus. The first is the daily attestation. We've all become very familiar with this in terms of coming to work or to campus every day. And this is the attestation you do through the Reopen CU app. If you're arriving from an international destination, you may not be able to download this till you arrive in the United States. That's okay. There's also a web-based app, so you can see what it's like if you want to look at that and have been unable to download the app. And there's a few components of this app. The first is the daily attestation. These are the 3 questions that you need to answer every day before you come to campus in order to get this famous green pass, which allows you access to campus. And that's really a reminder to just think about what you've been doing, if you're having any symptoms, if you've been exposed to anyone with COVID-19. And if you do have any of these and you check the box, then you'll get more options to see, okay, if you are having symptoms, what are those symptoms like? So again, just by checking one box doesn't automatically mean you'll get a red pass and be blocked from accessing campus, but it does help guide you in terms of what you need to do. So when you download the app, you can check those boxes and just see the kinds of drop downs that occur. If you don't hit submit, nothing goes through, so you can see what's on that app. So that's the first thing, that's the daily attestation. You have to do that every day you're coming to campus. If you scroll down on that app below the submit button, there's 4 check boxes, and these are the required elements you need to be on campus. The first one is signing the compact. This is our community compact, which says all the behaviors we all agree to keep our campus and each other safe. That's something you can read on the app, attest to, and get the checkbox right away. The second is the training. If you haven't done the training, again, you can link to that through the app or through the web and review the slides, which go over so much of what we're sharing today. And that checkbox will then be checked. The third is gateway testing and ongoing testing, which I'm going to talk about. And the fourth is the vaccination requirement, which I'm also going to talk about. By September, if one of these is not completed, you'll have an automatic red pass. You won't be able to activate campus, and you'll need to complete that to restore access to campus. So the first thing I want to mention is just travel and quarantine. We're so excited to welcome you back to campus. And I know many of you are not in New York right now, so we'll be traveling. And the requirements about travel testing and quarantine are different depending on where you're coming from and whether or not you're fully vaccinated at the time when you travel. So this slide hopefully explains those differences. So the first, if you're traveling domestically from somewhere within the United States and you're fully vaccinated, there is no quarantine required. There is no testing before you travel required, and no travel testing required after your arrival. That's you'll just have to do the gateway test, which I'll speak about momentarily. If you're not fully vaccinated, again, there is no requirement to quarantine, but there are some recommendations to test before you travel, 1 to 3 days, and 3 to 5 days after your arrival. This is different if you're traveling internationally, and these are based on CDC guidance and requirements for US air travel. If you're fully vaccinated, if you're fully vaccinated or not even fully vaccinated, you are required to test 3 days before your travel. Sorry, within 3 days before your travel. Anyone traveling internationally needs a test. That test can be a PCR or an antigen test, and it's required before you're allowed to board a flight into the United States. If you're fully vaccinated upon your arrival, you do not need to quarantine, but you are expected to test on day 3 to 5 after your arrival. If you're not fully vaccinated, you are required to quarantine upon your arrival. If you test on day 3 to 5 after your arrival, the quarantine is 7 days. And if you don't test, that quarantine is 10 days. So hopefully this slide, I'm going to leave it up there just for another moment so you can see which of these you fall into and can understand. I'm going to explain in a moment about testing, because if you are having to test on day 3 to 5, this counts as your gateway test as well. So gateway test, what is this gateway test? There's nothing magical about the gateway test, except it's the first test you do with us through our testing program. It's called a re-entry test. And if you haven't tested through our program in 2021, you are required to do this gateway test. If you're fully vaccinated, you're actually allowed to access campus while you're awaiting the results of that test. But if you are not fully vaccinated, you have to complete this test before you access campus. I'm going to give you a little more detail on how this looks because I know it's pretty complicated. So again, if you haven't tested this year, you are required to take a test at one of our testing sites, and this test must be done at one of our testing sites. So I'm going to break this down into vaccinated and unvaccinated individuals. So the first group is if you're fully vaccinated. You need to schedule an appointment. This is true for everyone. We don't do walk-ins for testing, and the appointments can be made through secure.health.columbia.edu. The schedule for testing opens about 7 to 10 days prior. So if you're looking for the schedule right now for September 6th, it's not open yet. Doesn't mean we're fully booked. As I said, it just doesn't open, and we'll have ample testing. We can do up to 3,000 tests a day. So don't worry, you'll be able to get an appointment. But on the day of your appointment, you need to do that daily attestation that I just showed you. Obviously, if you have symptoms, you shouldn't be coming in. And then you'll go to the testing site and you'll get your gateway test. We have 2 large-scale testing sites, one at Lerner Hall on the Morningside campus and one in the Black Building at the CU IMC campus. So schedule at whichever site is the most convenient for you. Again, if you're vaccinated, you can access campus on the same day that you had your test if you test prior to September 9th. So that's for those who are vaccinated. Now, if your test shows a positive result, you obviously have to isolate until you're cleared. Contact tracers will reach out to you, they'll give you instructions. If you have a negative test result, obviously you continue coming to campus and do all the campus activities. So that's gateway testing for fully vaccinated individuals. If you're not vaccinated, the first question to ask is, are you arriving from an international location? If the answer is no, if you've already been in the United States, if you've come internationally and you've completed a quarantine, you can schedule your appointment on the patient portal, secure.health.columbia.edu, for your first day on campus. If you are arriving from an international location and you're not fully vaccinated, you need to quarantine. And again, you need to test on day 3 to 5 so that you only need to do a 7-day quarantine. You can leave quarantine to come to our testing site to do that test as long as you don't have symptoms. And that simultaneously counts as your gateway test and your quarantine test. So you get 2 for 1 there. Again, on the day of your appointment, do your attestation, come to the testing site for your gateway test. For everyone, if you're not fully vaccinated, you are required to quarantine until your results are received. So even if you're not in a travel quarantine, if you are an unvaccinated student, but you've been in the US for a while, please do not access campus until your results are received. If you have negative results, you can access campus. Positive results, we'll reach out to you and give you guidance. But again, if you came out of quarantine on day 3 to 5 to do that travel test, continue to quarantine for your full 7 days. Again, if it's a positive test, we'll reach out. Negative test, you complete the 7-day quarantine. And then hopefully everyone has got their negative results, completed their quarantine, or completed their isolation after a positive test, and then you'll all be returning to campus. So I know it's very complicated. There's 4 different pathways here. We have put this up on the website as a PDF so that you can kind of follow the path for whichever one applies to you. Once you have completed gateway testing, as Wafa mentioned, we have ongoing surveillance testing. And this is really important because it helps us continue to monitor campus safety and make any adjustments to our public health protocols. So if you are vaccinated, as Wafa mentioned, you'll participate in our random surveillance sample. Every week, we reach out via email to a sample of those who've been accessing campus and ask you to come get tested. We give you a 2-week time period to do that test, and that is required to be tested within that 2-week time period. If you are unvaccinated, partially vaccinated, or completing your vaccination series, or you have an approved exemption, you are required to test every week. We are continuing to test the wastewater in our undergraduate residential buildings. If we see a spike, everyone in that building receives an email and must get tested within 1 business day. And finally, during September, what we call voluntary testing is still available. That means if you are not required to test weekly, but you do choose to get an extra test, you can do so with no more than 1 test per week. So quarantine and isolation, just to emphasize the difference between these two, there are a couple of scenarios where quarantine is required. If you are a close contact of someone who has tested positive for COVID-19 and you are not fully vaccinated, you will be required to quarantine for 10 days after your last contact with the infected individual. Once you are fully vaccinated, if you have a close contact with an infected individual, you do not need to quarantine. Our contact tracing team will still reach out to you to give you guidance on what to do. And everyone who is a close contact of an infected individual, regardless of their own vaccination status, are advised to get tested around day 5 after the exposure. And the second quarantine requirement, as we've mentioned previously, is if you've traveled and you're arriving internationally and you are not vaccinated. One of the questions that often comes up is, are you required to vaccinate on campus, to quarantine on campus? My apologies. Really depends on the date of your arrival. If you're arriving in the United States prior to moving into campus and you can complete that quarantine off campus, that's completely fine. You don't need to then repeat it on campus, but it's the first 7 days after your arrival in the US that you need to quarantine if you are not fully vaccinated. Isolation is required for anyone who tests positive for COVID-19, regardless of your vaccination status. If you have a positive test, you will isolate for 10 days. Similarly, if you are symptomatic and you're awaiting results, you isolate until those results come back negative. The vaccination requirement, hopefully you've all submitted your documentation by August 2nd. Everyone was expected to comply who could, but we certainly understand that some of our international students have been unable to access vaccination. Again, we do accept any vaccine that has been authorized either within the United States through the emergency use authorization by the FDA or through the World Health Organization. If you haven't yet uploaded or you are still completing your series, for those of you who are just arriving in the US and getting those vaccines, just upload those as soon as you get them done, even if it's partial, so we can continue to track and give you the necessary access to campus while you are completing a vaccination series. I just wanted to show you the quick checklist, the critical dates. So hopefully you've uploaded your vaccination data, but again, we are still accepting that from our international students as you continue to comply with the requirement. The compact should have been signed by the end of the day today. Again, you can do it through the web if you're unable to do it through the app, but if you aren't able to do that, you will have an automatic red pass, but as soon as you're able to download the app, you can sign the compact and that box will be checked. The training deadline is September 1st. And again, we hope everyone has met the gateway testing by September 9th. I do understand some of you may be arriving late. That's okay. You can just do your test as soon as you arrive on campus. We have gone through different phases of our safety requirements regarding masking, distancing, and testing. I've circled the area we're in, which is this mixed status of our campus with most of our affiliates vaccinated, but not everybody yet. And this shows the differences. Those who are fully vaccinated are masking indoors and participating in gateway and random surveillance testing. Those who are unvaccinated are masking and distancing and testing weekly. When we hit September 9th and we've deemed a fully vaccinated campus, nothing changes for our fully vaccinated. We are maintaining the indoor masking during September and we'll reevaluate then. And the vaccinated individuals will continue to participate in testing as I've described. For those who are unvaccinated, either with an approved exemption or are still going through their vaccine process, they are required to mask indoors and outdoors. Distancing will no longer be required, but continuing to participate in the weekly testing until they are fully vaccinated. And finally, I just want to remind you of all the support you have, both as you are virtual and as you return to campus through our medical officers, counseling officers, health promotion, disability services, and sexual violence response. So please be sure to reach out to Columbia Health if you're on the Morningside campus, or CUIMC Student Health on Haven if you're on the CUIMC campus, as we can continue to provide you with extensive support. And I will stop sharing there and turn it back to Julie.
Hey, Melanie, just since I'm answering a lot of the questions in the box, there's a lot of confusion around the 3 to 5 days and testing. Maybe you could just try to summarize it. I think there's at least 6 questions still pending.
All right, and I thought the slides would help, but I apologize if they confused you all more. So if you are quarantining, or if you have arrived from an international location, Your gateway test should be done on day 3 to 5 because it's a 2-for-1 test. You have to test on day 3 to 5 after arrival from an international destination, regardless of your vaccination status. So you use that test as your gateway test. If you are a domestic arrival, you can just test on day 1. So hopefully that's the clarification. 3 to 5 is only for arrival from international locations, regardless of vaccination status.
Great, thank you. Okay, I'm going to share my screen now and talk a little bit about return to instruction. We'll turn back to some of the other questions that we have been seeing also in the chat, as much as we've been trying to answer them as well. So let me just go through this a little bit. I just want to summarize, I think, what you've heard certainly between Wafa and Melanie's presentations, which is that there's a very robust monitoring plan in place, as well as a health and safety plan. And it includes all of these elements: a vaccination mandate, a rigorous testing program, a contract tracing program that has been well practiced over the last year, face covering policies, a compact, a daily symptom attestation, restrictions on gatherings and visitors. We didn't talk much about it, but there has been significant work done to environmentally upgrade our facilities in terms of air circulation, et cetera. And you will see visible signs everywhere you go, reminding you to wear your masks and comply with the Columbia Compact, in case you forget. So I want to just talk a little bit about some key takeaways. I think there's been questions about who does the vaccine mandate apply to. I think it's clear to all of you as students, but I want you to understand that it also applies to everybody on campus, right? And you will, as I think you heard, be able as international students to receive your vaccine once you arrive. And you will be given temporary authorization so that you can access campus. You'll have to follow the quarantine guidelines, et cetera, that you just, that Melanie just reviewed, but you will be able to move in and you will be able to go and get your vaccination and secure your appointment, et cetera. So you will have time to do that. At some point, as all students are required if you are not compliant with the vaccine mandate, anybody on campus will be subject and will not be able to access campus after a certain point. So for international students, it's important to know you'll have the temporary authorization while you're going through your quarantine and isolation and vaccine mandate requirement. But at some point, if you're not compliant, you won't be able to access campus. And again, that's to preserve the safety of campus. Again, a quick update about face coverings. All individuals, regardless of vaccination status, must wear face coverings in indoor campus spaces, and this includes classrooms. And we have put this in place through the end of September, and we will continue to monitor and update as needed. So unvaccinated individuals must wear face coverings both indoors and outdoors. So as you arrive and you're getting your vaccination and completing your vaccine requirements, you'll need to continue to wear face coverings. We're going to give you Columbia branded face coverings. Will be provided at orientation, and they'll be available the first few weeks of the term. Just also so you know, if faculty may have the option to teach with or with, they can teach with or without a face covering, right? So if a faculty member is standing in front of a class and is distanced from the class, they may be able to remove their vaccine so that they can lecture, and then they will put their face covering back on when they engage in conversations and walk around campus. So just again, we're trying to enable as much as possible productive and safe environments in the classroom. I think you heard about this and Melanie spoke about this, but again, to reassure places, we know that there may be some breakthrough infections, and any member of the Columbia community with a positive COVID test will need to isolate for 10 days from the time of first symptoms or from the date of their positive test. As Melanie mentioned, there'll be a Columbia contact tracing team, and they will work closely with the individual, with the faculty member to determine what instructions are needed regarding quarantine instructions. Faculty instructors, I know this is of concern to students, they will utilize a variety of methods appropriate to the course to ensure that students are able to make up mixed classes or assignments, and your school attendance policies will take into consideration the required isolation or quarantine period. So we want people to be safe. We want people who have symptoms or are not feeling well to stay at home and stay in their rooms and not attend class. And if they test positive, we will support both academically and from a health and mental health and physical health perspective, your recovery while on campus. There's been questions about externships and field experiences. Some programs require off-campus experiences that are part of their academic programs. Everyone will be required to comply and to adhere to the Columbia Health Compact. And if you're in place with an organization who, particularly in a clinical situation where they have enhanced requirements, you'll be required to meet both your Columbia requirements as well as those. And for now, international placements are subject to our travel restrictions that are in place for fall 2021. And again, I think another component to our safe return to campus is a restriction to visitors on campus. So all visitors to residential buildings will be restricted. We're really limiting in-person events and conferences will remain limited in the fall term, and priority are going to be given to those that support our academic mission and student life. Vaccinations will be required for all visitors whose duration on campus is 4 or more days. And for those classes, the guest speakers or lecturers, again, to limit our visitors to campus, will be virtual for the most part, unless there's a reason and it's deemed necessary. And those will be approved by the dean. So I think just a couple of key takeaways, and then I think I'm going to turn things over to Joseph to talk a little bit about the rest of life on campus, and then we'll try and answer a few more questions. I think, we're excited and very prepared. I think you've heard that throughout the presentation. There are robust safety measures in place. We've had over 10,000 members, Columbia affiliates, faculty, researchers, and staff on campus throughout the pandemic. So we're quite experienced in dealing with this pandemic here in New York and on campus. I think as Wafa mentioned, there's a monitoring plan in place. It's monitored daily. We look at conditions in New York City and on campus, and we will adjust things as needed. And I think one final reminder, which is that we all share a responsibility in ensuring a safe campus, right? So there's a Columbia contract that we ask you to daily attest. So we're asking people to take responsibility for their health. If you're not feeling well, please stay back in your room, stay back in your apartment, don't attend class. So we all, if you see people whose mask is not on correctly and you want to gently remind them, you should do that. And these are all the kinds of things that we do as part of a community to keep ourselves safe. So I'm going to stop there. We'll come back to some of the questions about the start of the semester and a delay in arrival in just a minute. I want to turn things over to Joseph for a few seconds or a minute.
Everyone, I'll keep this really quick. We're super excited that you're coming back. There's so much happening and planning for your student experience when you are back on campus, and to have it to be safe and vibrant upon your return. And so this has been done with the schools, the deans of students, student life teams, student organization leaders. Everyone is activated to really make this an exciting year for you and a safe year for you. Some of you have asked, are the libraries open? Yes, they are open, and you will have full access to the libraries upon your return to campus. People have also asked about their well-being and if Dodge Fitness and the other fitness facilities are open. Yes, they're open to all students through a registration process, just to make sure that we have the right space for you, similar to all the other gyms in New York City. I also want to let you know that you're going to have a full orientation program if you're a new student that will have both virtual and in-person components to that. And as well, we're hosting new and exciting events for all students to welcome home Columbia in the celebration of having your return. And that includes Columbia Welcome, which is an array of events over a period of time that everyone is welcome to join. Columbia Reflects, which is a moment of reflection about the past year, and Columbia Quest, which is a scavenger hunt to learn about all the exciting resources available to you throughout the campus. And we're not only just a vibrant campus, but you'll be coming to a vibrant city in New York City. And many of you have been asking about how to engage with the vaccine and showing vaccine. There's a variety of ways, including New York City COVID Safe, which is an app that you can simply upload your vaccination information to. And you can also just show a paper form. And if you're a New York City resident and got it in New York, you can use the Excelsior Pass. So there's many ways to get involved. And if you'd like to get involved in keeping our community safe as well, you can become a Keeping Our Community Healthy ambassador. And so you get weekly emails from me. There'll be information how to get involved in as a student and a student leader in all the efforts to reopen safely. And we welcome you. So we're super excited that you're here, and we're excited to welcome you back to Columbia.
Thank you, Joseph. I'm excited now, even more excited now that I've heard you speak. So I want to address questions, and I'm going to ask Maria Reynoso to join me because there have been several questions about a delayed arrival and what about short-term academic arrangements. So let me just speak broadly to that. For returning students. So if you are a student that's already been enrolled and you're not a new student and you're a continuing student, there are programs that are working with that will provide some access to high flex or hybrid courses for you so that you can continue to progress academically. For new students, so let me say it a little more clearly. How about this? We are an in-person campus. We are expecting a full return to in-person instruction. Some programs, and you should be, many of you asked some specific questions about specific programs, and so I really need you to be in touch with your academic program. Most programs that have a large number of international students are working very closely to provide some sort of remote access, whether that's hybrid or high flex access during the first 30 days of the semester, so that students who are arriving late and unable to be here for the first day of class, but plan to be here within 30 days are not lost or are able to keep up with their classes. Many programs are providing that. If they're not able to provide that because of other issues in terms of how they welcome students back to campus or their academic programs, they will work with you within the first 30 days to ensure that you can transition smoothly and begin your program in person as soon as you arrive. All of our programs know that specific areas of the world are experiencing visa delays and travel related delays, and everyone's really dedicated to working with you. But not all programs will have hybrid courses. Not all programs will have online courses. So you really need to talk with your academic program to make sure you have appropriate arrangements in place if you're going to be delayed. If you're a new student and you are not going to be able to arrive within the first 30 days, you should talk to your program about taking a leave of absence or deferring for a start in the fall. If you're a continuing student and you have less than 12 credits remaining in your program, please be in touch with your program to see if you are able to finish your program and the required courses in a remote or hybrid way. That is for a returning student only. Okay, so that's a big, those are sort of high level, I think, rules in terms of what we're trying to do in terms of being able to provide accessibility and ensure that international students who are delayed briefly, okay, so they're not here for the first day of class, but planning to be here within the first 30 days, are able to engage academically, participate in some of the orientation activities, etc., remotely. But please be in touch with your program. Maria, can I ask you to jump in just from a visa related perspective?
Yes, of course. And thank you, Julian, and welcome everyone. It's very exciting for me to be here. And Julie has said it very well. Please keep in touch with your school departments if you think you will be arriving late. In terms of I-20's dates, if you are arriving after September 9th, for example, you will not need an updated I-20 with a new start date. So the I-20 that you currently have in your hands will allow you to enter the US after September 9th. Now, something important here is that if for any reason your visa appointment date is going to be a schedule for, after September 9th, please do contact our office, because in that case, we will need to update your I-20 and send you a new I-20, because the consular officer will not be able to grant a visa if the start date has already passed. So please keep that in mind so you don't have delays to the visa interview. There have been questions about national interest exceptions. Very interesting questions, and thank you very much for asking us those questions. Right now, students from Schengen area, the UK, Ireland, also India, China, Brazil, South Africa, and Iran have a blanket national interest waiver. And right now, F1 students do not need an exception. It's a blanket exception that will allow everyone, every student to enter the US. If you're having issues with that information, please do contact us, and then we'll help you find information and guidance about that. So again, these national interest exception should not be a reason to delay your arrival to campus. Also, if you are a J student, J1 students will need to contact their US embassies to get a national interest exception for them. However, we do not have many students that will hold J1. So if you are having issues with that, please let me know, and please contact me personally. You can just plug my name in our website and then just find my email, and then just send me an email, and I'll be happy to work with you closely and to clarify anything. Thank you.
Maria, can you speak a little bit about the 30-day requirement, its implications for OPT? And
Sure. So because we have reporting requirements, students will need to arrive within 30 days from the program start date. So right now we are using the September 9th, which is the official start date of the semester, as the 30 days mark to count towards those 30 days. So do please arrive, make every effort to arrive on campus within those 30 days, especially if you've been admitted to a 2 semesters programs such as LLM or the journalism program, or any other programs that's very short. As you know, to be eligible for OPT, you will need to have 2 semesters of enrollment on campus. So those 30 days will allow you to make you eligible to apply for these work authorization, which is the benefit of being on F1 student status in the US.
great. Thank you, Maria.
Sure.
I think that addressed many of the questions we were seeing in the chat. I think we've addressed a lot of the questions. I know, Melanie, there's still some testing arrival from international flights, so maybe you could review that one more time in terms of what is the sequence and timing of events once a student arrives from an international location.
So there's the pre-arrival testing, and this is not a Columbia requirement. This is to get on a plane to come into the US. You need to get either a PCR or an antigen test to get on a plane. You'll be required to show that at the airport and fill out a passenger attestation. That's required for the US airlines. Columbia doesn't need to see those results. Then you arrive here. If you are unvaccinated, you will quarantine when you arrive, and you will test on day 3 to 5, which serves 2 purposes. It serves as your gateway test, and it serves as your quarantine test, which is also recommended by the US CDC. If you are fully vaccinated, you do not need to quarantine, but you are asked to get that day 3 to 5 test after your arrival. And if you can, make that your gateway test as well. One question did come up in the box saying, well, hang on, I'm going to not have campus access after September 9th if I wait to do my gateway test. If that's the case, do your gateway test on day 1, and then the following week, do another voluntary test, which will then meet that post-travel test. So really, the day 3 to 5 is just if you are arriving from an international location. For those in quarantine, it must be on day 3 to 5. For those who are vaccinated and not quarantining, do it as you need to do it, but make sure you get a test on day 3 to 5. And if you're not arriving internationally, your gateway test is as soon as you arrive on campus.
There's a question about our Melanie or Wafa, perhaps you can just speak to how many days need to pass until someone's considered fully vaccinated, and how that impacts moving around on campus.
Yeah, So fully vaccinated is 14 days after you receive your final dose of your vaccine series. So if you're getting a Pfizer or Moderna, it's 14 days after dose 2. And if you're getting the Janssen J&J, it's 14 days after the single dose of that. Until that time, you're considered partially vaccinated. You are allowed to move around campus. You are allowed to access campus, but you're going to have to follow the same requirements as someone who is not vaccinated. So that means masking indoors and outdoors at all times and testing weekly until you hit that 2-week mark.
Great, thank you.
And just to reinforce something that Melanie said several times is that the quarantine and the testing post-arrival applies to everybody, whether you're vaccinated or not vaccinated, because there are several questions that are getting at that issue.
Right, which makes me think maybe we should define quarantine and isolation versus isolation for us from a public health measure. So I could do that, but I think I'll let Wafa or Melanie do that.
Sure. Isolation is the term that applies to someone who's diagnosed with a disease. So someone diagnosed with COVID-19, we know that they require a 10-day isolation. And quarantine applies to separating an individual who's had a contact with someone potentially who had COVID-19, or for a traveler, for example. Again, it's called quarantine because that individual is not diagnosed with COVID.
Thank you. Donna, can you speak a little maybe just about visitors and move-in days and how that might work in terms of our visitor policy? Because I know we are allowing people to have somebody help them move in. I've seen that question come up.
Sorry, I'm busy thinking and answering questions.
Yes,
so.
I know. I'm sorry. I caught you off guard.
Okay, so
Sorry
that's okay. We have almost as many questions as we do people. So it's,
yes.
And it is confusing. I mean, the testing is still confusing, I think, for people. So we're going to try to simplify on the website, you know, how you fit into these different categories, because as you've heard, there is testing that's required to enter the US, and then there's testing that is Columbia specific. So we are going to be pretty restrictive, just given what's going on right now in terms of visitors to the campus. So, but for orientation, you know, parents can come, people who are assisting you in move-in, they can come. They will all be fully masked. Their time on the campus is going to be limited, and a lot of the orientation activities are outdoors. But on an ongoing basis, we are going to require visitors to complete symptom attestation. So in other words, if they have symptoms, they will be filling out forms that will restrict their access to campus. And then there's a lot of people who are on campus who are visitors. We call visitors anybody who isn't a Columbia affiliate, meaning they're not getting paid by Columbia, they're not a student. We have vendors, for example, that operate the bookstore. It's probably the best example. They will be required to be vaccinated as well. And so we're working through all of that. So it's only the very, very occasional visitor who comes into Columbia facilities that will not have to be vaccinated. And in addition, we are restricting for now any visitors to post move-in. Non-Columbia affiliates, we are restricting access to the dorms just because we have no control over whether they're vaccinated or not, and we think it's just safe to keep them off campus right now.
Thank you. We are just about out of time, so I'll say a few things in closing, which is, I think first, please monitor the COVID-19 website at Columbia. We continually update it with information that reflects what's happening on campus, and we use the questions and answers that you have supplied to us throughout this time to update our Q&A on the website. So you will see some of the information that was provided today and some of the answers to your questions updated on the website. If you have more visa related questions, and I know there are certain situations, and I saw some additional questions, please reach out to Maria Reynoso or to ISSO so that you can get your questions answered. They know that there are many questions as we lead up to the start of the semester. Please check the University Life website for activities related to return to campus. There, as I think Joseph outlined, a robust series of activities, and we will have events to specifically welcome international students that will happen after the welcome back activities so that we'll have an ability to welcome international students to campus as well. We will keep these webinars going as long as we think they're needed, and we really appreciate your participation. Thank you very much to the panelists, and please stay in touch and ask any questions that you can through, and look at the website, and we will continue. And please also, from an academic side, reach out to your academic programs and schools who can speak specifically to your academic program and what will be available to you in the fall. We look forward to seeing you very soon. Thank you, everybody, for joining us and for joining us as panelists.
Thank you.